Gregory Johnson, and we have Candace here with us today, and this is your very first time of ever seeing a chiropractor, right?
Correct.
So we're going to show you a very first time chiropractic examination and treatment on Candace today. So we're going to use her, she says, as a guinea pig, but we've done this many times, so I'm going to have you close your eyes for me first, Candace, and flex your head forward and then backwards. And remember how that felt, and then back to neutral for me now, and keep your eyes closed for just a moment. So she's got the normal forward head posture that almost 98% of people have when they come in the door. It's a very high percentage of the population that has forward head posture. A lot of people call it text neck or computer neck, reading neck. You're looking down a lot. So, and as you can see also, her hands are way out in front of her and they're not at her side, they're out in front of her. And her pelvis has translated to the left on the x-axis, as well as her thoracic spine. So she's got a little curvature in here because her neck translates to the right. So she's got a curvature in compensation to all that, which is called a scoliosis. So now I'm going to have you lie on your back here, Candace, and we're going to do some orthopedic neurological tests on you. These are very standard tests that you would get done if you went to an orthopedic surgeon or a neurologist, as well as chiropractors should be doing this as well. Now, the first one I'm going to do is called straight leg raise test. And besides the tightness you feel in your hamstring, does this hurt your lower back or shoot pain down your leg at all?
It's more like
In the pelvis there? Okay. Tell me when it feels better.
better.
Okay, relax your leg in my hand. There you go. Does this cause any back pain or leg pain?
Do you? No.
Okay, good. Now I'm going to cross your leg over here, and I'm going to push this down softly. Tell me if you feel any deep hip pain or pain in your low back. It's already in your hip. Okay. That's a positive Fabry-Patrick test on the right. That tells us she has a hip problem, and that can be anything from just a hip misalignment with the femur and acetabulum to a leg Calvé-Perthes disease. Any low back pain or leg pain on this side, besides the pulling in your hamstring?
No.
Okay, now, does it feel easier though down here?
Yeah.
Here, relax your foot in my hand. Does that cause any back pain or leg pain?
No.
That's called a Braggart's test, and that's negative on both sides. That's indicative of a herniated disc. Now I'm going to push down again. Does this hurt your hip joint or your back? Okay. So negative Fabry-Patrick on the left side as compared to the right. So we're testing her individual nerves out of her low back now. Muscle strength, push against me. She's got good strength there and flexion. Now extension up. Yep. Now turn in against me. And now out against me. Okay. Push with your big toe. And pull up with your big toe. Okay, that's all good and strong. Push real hard. Pull up hard. Turn in real hard. And externally rotate hard. Good. Now push with your big toe. And bring up your big toe. Good. You're a little bit stronger on this right side. Did you notice that?
Yeah.
Okay, I'm going to have you lift your head up now. This is called a Soto Hall test. Do you feel any pain in your spine anywhere when I do that? Like in your neck and upper back? Did that tighten up or hurt more?
A little bit.
Okay, like mostly right up in here. Okay, let's sit you up and face that way. So she does have a positive Soto Hall, but you can also test this way. Does that cause the same kind of pain right up here? Okay, now just look straight ahead. This is called a foramina compression test, and this is straight down. Normally that won't be positive unless you have a severe cord injury or problems. Does that hurt at all?
No.
Good. Because that's using the joints to hold it. Now when we come backwards and to the right and down, I bet that one hurt more. In your neck and upper back?
Yeah, probably.
Okay, let's go back on the left here. Does this one hurt on this side? Same area down here in your lower neck and upper back? Those are called maximum foramina compression tests, and they do indicate pinched nerves in the lower neck and upper back. Does that cause any pain or tightness through here?
A little bit.
Okay, this is just a lateral flexion. Now this is called a shoulder depressor test. Does that make it worse?
Yeah.
Okay, so that's a positive shoulder depressor on the left. Is there any tightness or pain when you tilt left? Is it worse going left?
Yeah.
So this is a range of motion, and here's your shoulder depressor test. Does that make it worse?
Yes.
Okay, so you're doing fine. Now turn your head like you're looking left for me, if you would, Candace. She's got great range of motion to the left. Now still right. Yeah, pretty good range of motion there, but I bet you sleep with your head turned this way most of the time. She's a stomach sleeper, she told me. So you can always tell which way they're sleeping. I'm going to push down real hard. You hold this up. Okay, good. That's the deltoid on the right. That's C5. That's the deltoid on the left. That's also C5. Now we're going to test her biceps, which is C6. I'm going to pull out. You resist. Good. Relax. I'm going to reposition you and push in. Test your tricep. Excellent. So she's playing strong. Okay. Hold. And hold. Now muscle testing is graded on a scale of 5, and she's 5 by 5 so far in the upper and lower extremities. Now I'm testing her reflexes, so go ahead and relax that right my hand. There you go. Now I'm testing her biceps reflex, which is good. That's a +2 in the triceps and brachioradialis. So we'll test her right biceps now. Just relax that. There you go. You can only get good reflex testing when the patient's totally relaxed. Triceps good. Now relax and cross your legs for a second. Her patellar reflex is +2 equal and active bilaterally, and her Achilles reflex is also +2 equal and active bilaterally. So that's good. Now, if you can stand up and walk on your tiptoes only that way for about 3 steps, I just need to make sure you can do that. This is called the heel-toe test. Okay, you can turn around, walk back to me on your heels only. Okay, great. You can stop right there. Now, if you were to bend over like you were going to touch the floor, tell me if and when you have any back pain.
Okay.
Tell me when it starts, if it starts.
Oh, probably.
Right there? Is it down here? Okay, now does it hurt coming back up?
No.
Okay, so now keeping your knee straight, let's cross this arm here and this one up here. We're going to lean backwards. Tell me if that hurts going backwards.
Oh.
In the lower back, yes? Okay, I'm going to twist you to the left and push down. Does that make it hurt worse? Okay, how about when we go over here to the right? Does that hurt worse?
Yeah.
So she has, that's called a Kemp's test, and that was positive bilaterally, so that means she's got lumbar spine and lumbosacral misalignment and pinching on the nerves there. So now I want you just to tilt left with your arm over your head like this. Tell me if there's any pain along the course of your spine anywhere.
A little bit.
Down here? Okay, now to the right. So we're evaluating her range of motion right now, which is full range of motion, but she's having pain with that too, right?
A little bit.
And now back to neutral. Now, if you just twist left, does this cause pain in your lower back? Yep, on the left side primarily? Okay, how about when you twist right? Does that cause any lower back pain?
A little bit.
Not as bad on that side? Okay. Now, let's have you come over here and lie on your stomach next. So range of motion was good, but she had pain at the end range of motion, which means that the joint itself is not going through a full pain-free range of motion, which indicates vertebral subluxation or misalignment of the vertebra, one or more of them, or the pelvic bones. Relax those right there. Now I'm going to be palpating her spine, which is where you take your hands and you feel her spine and pelvis and see if there's any vertebrae that are misaligned. Okay, so I'm going to do a leg check on her first, and her right leg is a ½ an inch shorter in this position. Now when I bring it up, it actually gets even. I bet you that tightens up in your lower back right there, huh? So she's got a right leg short by ½ an inch. She's got a positive knockless test, which where she feels pain down here and tightness, and her pelvis raises up in the air. Now, it's probably tender right there as well, and also right there. So she's got bilateral sacroiliac joint misalignment. There's L5. That's where you get most of your back pain right there. Now, those are all sore, aren't they? Yeah, so she's got L3, 4, and 5 spinous process pain, and she's also got paraspinal muscle hypertonicity on both sides, but worse on the right. Do you feel it more so on the right? Yep. Okay, so I'm going to feel her thoracic spine, and you can watch my hands here. You can see the actual curve in her spine right here all the way down into her lumbar spine. So she has a left convexity scoliosis. That's tender right there. Real bad. That's where you get a lot of your mid-back and upper back pain, isn't it? And right here is really bad. This is the area that supplies your lower ribs that make that diaphragm weak or unweak. If it's lined up properly, it's not weak, and it doesn't let the stomach slip up through. She's had some issues with hiatal hernia as well, and IBS. So this is the area most commonly associated with that. Down here in the lower thoracics, those are all sore, right? Yeah. And then down here at L3, that's real sore. That goes to the colon and the female organs. Do you have problems when you have your period sometimes? With cramps and stuff?
Oh, yeah.
Okay, so a lot of dysmenorrhea or cramps can happen when the L3 vertebrae, L3 and L4 are misaligned. Now, I'm going to have you lock your whole right leg straight and lift your right leg off the table. Okay, does that hurt to do that? Anywhere? Not that bad? Okay, let's put that one down and lift your left one up. Now, you see she can't come up as high on this left side. That was harder, wasn't it? So that tells us she's got a left sacral deviation right here, and I bet you that's tender right there.
Yes.
Yeah. Okay, you ready to feel better?
Yes.
Okay, so all you gotta do is breathe. You get the easy job. So I'm gonna start off by adjusting her right SI joint because her right leg's short by 1/2 inch. This is her very first adjustment ever now, mind you. So, we treat every patient who comes into advanced chiropractic relief as an individual, treating their specific problems. Now, her sacrum deviation was to the left, so I'm on the left side of her sacrum right now, adjusting that superior to inferior in the y-axis there as well. Now we're going to do the left SI joint in her left hip right there, and we're going to get this right SI joint from internally rotated, we're going to externally rotate it exactly in a mirror image. We also adjusted in the 45-degree angle that it articulates with the sacrum in, the ilium and the sacrum, meaning sacroiliac joint. There's sacrum on the right, sacrum in the center, and then sacrum on the left again. Now I'm going to move up into her lumbar spine at L5. And you'll notice that's pretty much a straight P to A adjustment in the Z-axis. L4 is also pretty straight in that P to A axis on the Z-axis. Now my angle in my arm will start changing. There's L3. These will be a little bit sore at first, but they'll feel a lot better when I get done. And then here's L2. And then I'm going to go ahead and have you slide up in here just a little bit more with your head. There you go. I'm going to put your head down just a little bit more. We're going to open up her spinal joints a little bit by flexing her head forward. And I'm going to adjust her mid-lower thoracic spine. Just exhale. There we go. Good. Let all this relax out again. Just exhale. Good. And same here, just exhale. Excellent. Now her upper thoracics, you're going to notice that my angle changes dramatically. There we go. It's more of a superior to inferior adjustment up here. Okay, just exhale again. There we go. And just relax. Okay. We're just making sure we got all these to move in their proper alignment. Now, I'm going to have you lock your right leg straight again, lift your right leg off the table again. Okay, so you see where that one's at. Let's do the same thing on the left side now. Now look how much better that left side got. Did that feel easier that time to you? Yep. So we got rid of the sacral deviation on the right or the left. Now I'm going to adjust her T1 and T2 vertebra with the thumb move. Right there, perfect. Good job. And just relax like that again. Boy, that was perfect. Felt those, didn't you? I was trying to be quiet so you crack addicts out there watching our videos can get the thrill of the noise. I know you love that. And this is one of those things that hurts so good whenever I put deep pressure on these muscles that have been so tight for so long. You get trigger points in them, which are little toxic metabolic waste dumps, basically. Feel those knots right there? That's tender, but it feels good at the same time, huh? Now, right now, I'm only using my thumbs because this is her first visit, and I don't want to scare her off by using my elbows quite yet. And we're not going to pull the turbinator out on her yet today either. We'll use more of the Genie Rub, which is a softer type of vibratory percussion, which will increase blood supply and relax the muscles. There we go. Tender right there, too. See, these are where the ribs attach to the vertebra, and they get really tender when they're out of place. So we're going to go down and recheck her to make sure everything got lined up. And her legs are exactly even now. And they stay even. And her pelvis doesn't raise up. I bet you that feels better too.
Right.
Yep. So she has less pain there. She did not have a positive nocklus or diaphragm on the right that time. So now we're going to increase the blood flow into this region by doing some percussion, vibratory sensation in here. Down in her gluteus medius and maximus and piriformis muscles, as well as her tensor fasciolata muscles on the side. Her hamstrings are probably going to be pretty tight, especially on this left side since her sacrum is deviated on the left. Probably a little sore down your calves right there too. That a little tender? What's that? Feels good tender, huh? This is another one of those hurt so good things. Same thing over here on the tensor fasciolata. A lot of people call this the IT band. And then in the hamstrings, you get down deep in there along the, you notice I'm working along the long axis of the fibers, which is how they run. I'm not doing any transverse friction on her yet. That's too painful at this stage of her care. So we'll save those for a future video with her. Now she's supposed to have a nice smooth forward lordosis or curve forward in her lumbar spine, and hers has flattened out a little bit because her vertebrae are misaligned and the muscles are hypertonic, so they'll pull that spine flat as opposed to letting it have a curve. If you have too much curve down there, a lot of people call that sway back in lay terms. It's called a hyperlordosis in scientific terms, or chiropractic terms, or medical terms. But she has a hypolordosis, which means less than normal. But I've adjusted the areas that are supplying the nerve supply to her colon, her female organs, and also to her small intestine and diaphragm here, so that should help her hiatal hernia symptoms and IBS by correcting what's causing it. I'm not actually treating her hiatal hernia or IBS, we're treating the underlying cause of that, which is nerve dysfunction to those organs. That's what makes what we do so unique, and why patients should start off with chiropractic care as their primary port of entry, as opposed to taking drugs or having surgery first, because those things are oftentimes irreversible and the damage is already done. But you've already seen medical doctors and taken medication for a lot of this stuff, right?
Mm-hmm.
Yep. Did it help you?
Mm-hmm.
Not really, huh? Didn't really help you get rid of the problems, it just helped the symptoms temporarily, right?
Mm-hmm.
Yep. So right now I'm doing some Golgi tendon work on her paraspinal muscles in her thoracolumbar and lumbar spine regions. And now that I'm repalpating her spine, we don't see as much curvature in there already. Excellent. Okay, let's turn you on your back now. That wasn't too bad so far, was it?
No.
Okay, so now just relax your head right in my hands as if you're going to sleep. You can put your hands on your tummy. There you go. Excellent. This is a diversified palmar cervical rotary brake. Excellent. Good job. Okay. There we go. Yeah. I'm going to adjust your knees and your low back all in one move here, so I want you just to keep breathing. There you go. You should have felt that in your knee and your low back, did you? Yeah, good. Okay, I'm going to do the same thing over here. Pretty good stability on the knee, just a little bit of laxity. There you go. Did you feel that one in the knee and low back as well? Good. Okay, slide all the way back up that way for me for just a second. Okay, I'm going to put this hip piece up a little bit for you. There you go. Now I'm going to pull your stomach down through your diaphragm here. So take a real deep breath in. Let all your air out. Now I'm going to grab the fundus, or the top of the stomach, right under the xiphoid process and the left side of the ribs, and I'm going to pull it straight down deep. Okay, good. And another deep breath in. And then now exhale, and keep exhaling for me as I push this down and then pull it down. Do you feel that knot right there? That's your hiatal hernia right there. But I'm pulling it back down through the diaphragm so it will help release that pressure feeling and that bloated feeling as well as any acid. Okay, go ahead and do it one more time. And keep letting all your out as I pull this down. Excellent. Now right here is the ileocecal valve. I bet you that's sore, isn't it? Sometimes this gets clogged up too. It's the valve between the small intestine and the large intestine. Do you like popcorn or nuts or anything like that? Things with shells or husk on them? Corn, peas, popcorn? Yeah, a lot of times those husks get stuck in the ileocecal valve. Now we're on this left side, the valve between the large intestine and the rectum is right here. Is that also a little sore?
Mm-hmm.
You see this sore a lot with IBS, which is irritable bowel syndrome. Sorry. And notice I'm rubbing that in a clockwise type motion. And then I do a little bit of colon massage very lightly. I'm not pushing in here real hard, although it might feel like it to her at this point in time because her bowels are sore just from being inflamed. That's what IBS is inflammation of the bowels. Irritable bowel syndrome or inflammatory bowel syndrome, same thing. So I'm pushing down in here and kind of doing a clockwise type of rotation, which probably is a little tender, but it'll feel better when it quits hurting. There we go. Some people get that and others don't, but I say that a lot. That's one of my favorite lines. It'll feel better when it quits hurting. There we go. Good. Excellent. Okay, now let's have you sit up and face towards your neck for me, please. And notice when you get up sideways like that. Good. You should be able to breathe easier already. Okay, I'm going to adjust her right shoulder back in place. There we go. That was excellent movement in the glenohumeral joint. She doesn't have as much popping and grinding over here, but she does have a little misalignment there still in the glenohumeral joint. You probably heard that move. Okay, now your elbow, just relax it. And her wrist. There, that's a good movement. And we're going all the way down into her digits, so we're going to follow the entire pathway of the cervical brachial plexus. Good, her elbows are in pretty good shape. There, her wrists are both out. And it doesn't hurt to crack your knuckles if you do it this way. If you traumatize them, that will cause osteoarthritis, so I don't recommend that. So, Candace, that was your very first chiropractic adjustment. Would you mind telling our YouTube subscribers how your first experience with chiropractic was for you?
I was very nervous, but it was very worth it.
Yeah, good.
Yeah.
Would you advise others who have not tried chiropractic to
Yes.
come in and get adjusted and
Yes.
examined this way? Good.
Yes.
How did this compare to the care that you've had in the past?
A lot
Medical
better.
care.
I feel a lot better already.
Naturally, without any drugs or surgery. Good. Well, thank you for sharing that with our YouTube audience. And let's come over here and finish it. One other thing I'm going to do, I'm going to use this adjusting instrument. It's a Pro Adjuster. And I got this from Dr. Mark Simmerin out in Laguna Niguel, California. Now, I'm going to have you close your eyes again and relax your arms. Just totally relax them. Flex your head forward and then backwards for me, please. And remember how this feels. Back to neutral. Okay, now when you open your eyes, look in the mirror, but don't move. See how your head was a little bit left and turn to the right? See your pelvis is a little shifted to the left out of center? So this will be your homework right here. You're going to lift up with your trapezius muscles and simultaneously pull back with your rhomboids here. Clear your hands, palms forward. You see how it tightens up your whole trap? Then we're going to bring your head straight back in the Z-axis, not up yet. Okay, yeah, I know, kind of off balance. And then we're going to shift you. You're already right, so we're going to go left here. Now, your pelvis was left, so I want you to shift your pelvis straight out to the right for me. This is called mirror image adjusting with the adjusting instrument. Now I'm adjusting her atlas on the x-axis with this adjusting instrument. This will reset and recalibrate her cerebellum, which controls balance, posture, coordination, and all kinesthetic movement throughout the body. So we're going to reteach her brain how to hold her in place as opposed to out of place. You can relax now. And let's have you flex your head forward and backwards again. This should feel smoother to you. Tell me if it does. was easier, wasn't it?
Mhm.
Felt like it was on a swivel compared to
Yeah.
the first time, huh?
Yeah.
You see how your shoulders are exactly level now, and your head's in the center, your earrings are even. And look at your pelvis too. It's right in the middle now.
Mhm.
Great. So, Candace has survived her very first chiropractic adjustment at Advanced Chiropractic Relief, and this is your Houston chiropractor. We'll see you next time.